Myself Arthi, Assistant Professor in ES College of Nursing. Today I will present my topic on tonsillitis. So tonsillitis, it is one of the immune system. It is located in the backside of the throat. So it maintaining the various functions, especially it act on the immune functions, and it help to prevent the unnecessary bacteria and foreign body enter into the mouth. So this is a small introduction of tonsil. Next we'll move on to definition of tonsillitis. So definition of tonsillitis means, so tonsillitis, it is infection and inflammation of the tonsil. So it is one of the productive and lymph glands that are situated on both sides of the throat. The tonsil constitute an important part of the body and immune system and are vital defense organ. Already I said it is a productive organ, unnecessary entering of virus and bacteria into the mouth. So one more definition. So tonsillitis, it is the infection and inflammation of the tonsil. It is characterized by sore throat and fever. If people having the tonsillitis means the affected persons having the severe fever and throat pain and also dysphonia. So it means it is the difficulty in swallowing and difficulty in speaking. So next we'll move on to causes of tonsillitis. So causes of tonsillitis, it is the major cause of the tonsillitis. It is the group A beta hemolytic Streptococcus bacteria. It is one of the major causative organism for developing tonsillitis, and also virus also responsible for developing the tonsillitis. So adenovirus and influenza virus, Epstein-Barr virus, coronavirus and enterovirus and herpes simplex virus. These are all the viral name for developing tonsillitis. Next is the types of tonsillitis. The types of tonsillitis, it is divided into three types: subacute, acute and chronic. So the subacute and chronic, it is further divided into 3 or 4 categories. So first we will see the subacute tonsillitis. So subacute tonsillitis means it is the less infection of it is a less infection of acute tonsillitis and less infection of acute tonsillitis is the meaning of subacute tonsillitis. In this condition also patients having the mild fever and sore throat. Okay, and next is the acute tonsillitis. So acute tonsillitis symptoms, it is developed less than 3 months. And chronic tonsillitis means a person's having the symptoms more than 3 months. Okay, so first we will see the acute tonsillitis. So acute tonsillitis is the infection and inflammation of the tonsil involving the surface of the epithelium. So the tonsil having the epithelial cells. If people having the acute tonsillitis means it is totally affect the epithelial cells of the tonsil. And also lymph tissue. So if people having the tonsillitis means patients having the enlargement of the lymph nodes, and also patients having the unable to swallow it properly, including saliva also. Already I said, so acute tonsillitis, it is further divided into 4 types. So acute superficial tonsillitis and acute membranous tonsillitis and acute parenchymatous tonsillitis and acute follicular tonsillitis. See one by one. So first we will see about the acute superficial tonsillitis. So superficial tonsillitis means superficial layer of the tonsil and the mucosa membrane will be affected in the tonsil. So this is the meaning of superficial tonsillitis. And next is acute follicular tonsillitis. So acute follicular tonsillitis means see the picture and small yellow color spots over the tonsil. Small yellow color spots over the tonsil. This is the meaning of acute follicular tonsillitis. And next is the acute parenchymatous tonsillitis means the uniformly enlarged and erythematous with the exudates, edema, uvula and soft palate. So you see the picture of follicular tonsillitis. See the each side of the tonsil will be enlarged in the acute parenchymatous tonsil types. So and also edema formation over the uvula and soft palate. This is the meaning of acute parenchymatous tonsillitis. And next is the acute membranous tonsillitis. Sometimes from the crypts sometimes some of the exudate formations over the tonsil. It is called as acute membranous tonsillitis. Next is the signs and symptoms of acute tonsillitis. So already I was said in a various abnormality changes in the tonsil. So first we'll see the tonsil appearance, conjunctions and swollen yellowish spots over the tonsil. If yellowish spots around the tonsil means this abnormalities mainly seen in the follicular tonsillitis. Next is the whitish membrane appearance. In this type, mainly in the membranous tonsillitis will arising on the this type of signs and symptoms. Next is the in parenchymatous tonsillitis, if a patient is having the reddened enlargement of the tonsil. Next is the hyperemia of the palaris, uvula, soft palates, and allostosis. Allostosis means it is the bad odor or bad breath, impacted movements of the palate, and increased secretions. Next is the enlarged and tender jugulo-digastric nodules. So enlargement and the tenderness over the each side of the lymph nodes. Next is the symptoms of acute tonsillitis. So sore throat and refused eat due to the adenophagia. So adenophagia, it is otherwise known as difficulty in swallowing, and including saliva and water. So in this if a patient is having the adenophagia means the person is not able to eat properly. Next is the earache, either referred pain from the tonsil due to the acute otitis media. One of the important reason for tonsillitis, it is if people having the ear infections or any respiratory tract infection or this sinusitis problem. So these are all the important reason for persons getting the tonsillitis. And voice become thickened and muffled, jugulo-digastric nodules are enlarged and painful. So next is the fever. It is a main signs and symptoms of tonsillitis, may be associated with chillness and rigor, headache, and tachycardia. So these are all the signs and symptoms of acute tonsillitis. And next is the chronic tonsillitis. So next we will move on to chronic tonsillitis. So chronic tonsillitis is a persistent infection of the tonsil can causes the tonsil stone. If chronic tonsillitis means already was said. So chronic tonsillitis means it is the repeated the symptoms arising on the more than 3 months. If people having the acute tonsillitis or any throat infection, if not taking the proper treatment for the acute tonsillitis or any other ear infection or sinusitis problem, laterally it will be affect the tonsil. If in acute stage you take the proper treatment means the chronic tonsillitis will be not come. If not taking the proper treatment for acute tonsillitis, laterally it will be converted to the chronic tonsillitis. So etiologies for chronic tonsillitis, see the complication of acute sinusitis already was said, and subclinical infection of the tonsil, and next is the chronic infection of the sinus or teeth. So types of chronic tonsillitis, it is a chronic parenchymatous tonsillitis and chronic follicular tonsillitis and chronic fibroid tonsillitis. See one by one. So first we will see the chronic follicular tonsillitis. The tonsillar crypts are full of cheesy material resulting in yellow spots on the surface. So already this follicular stage I was discussing the acute follicular tonsillitis. So already I was said in it is a small yellow color spots appearance over the tonsil. This word I was mentioned in acute follicular tonsillitis. So in comes on the chronic follicular tonsillitis. In this stage, full of cheesy material and yellow color appearance over the each side of the tonsil. This is the meaning of chronic follicular tonsillitis. And next is the acute parenchymatous tonsillitis means, so this tonsil are very much enlargement, almost touching each side, may interfere with the speech abnormalities and totally alter the respiratory functions, and also patients having the pulmonary hypertension. So I will show the one picture for see the picture. This is the picture of if people having the chronic follicular tonsillitis, yellow color appearance and cheese like appearance around at the each side of the tonsil. I will show the one more picture. See the picture. So if people having the parenchymatous chronic parenchymatous tonsillitis means, you see the picture, the each side of the tonsil will be enlarged, untouched and meet together. Okay. So next is the chronic fibroid tonsillitis. The tonsil are small but infected with history of repetitive sore throats. If people having the chronic fibroid tonsillitis means if people having the repetitive sore throat and repetitive infection for the fibroid tonsillitis patients. So signs and symptoms of chronic tonsillitis, it is um, the the tonsil become small or conjected, and patients having the abnormal secretions presence over the mouth. And next is the pus oozes presence over the tonsil. And next is enlargement of the digastric nodules and retention of cyst, yellowish swelling filled with the yellow liquid and yellow liquid presence over the tonsil. Next, we'll move on to pathophysiology of chronic tonsillitis and due to etiological factors. So, what are the etiological factors? So, etiological factors means if a patient's having the untreated ear infection or untreated acute tonsillitis or untreated throat infection or untreated upper respiratory tract infection or person's exposure of group A beta hemolytic Streptococcus bacteria. So, already we said, so the group A beta hemolytic Streptococcus, it is a important bacteria for developing chronic tonsillitis. Not only the chronic tonsillitis and tonsillitis, so bacterial infection. The bacteria name, it is the group A beta hemolytic Streptococcus. It leads to, if a person is having the exposure of bacterial infection, the next step, it is the protective immunity not developed yet, prone to infection, and it leads to stimulate the inflammatory response. A stimulatory inflammatory response, it leads to tonsillitis. So if people having the tonsillitis means, now the time a patient is having the various signs and symptoms, especially in the inflammation of the tonsil and fever, or tonsil increasing in the size and may obstruct the airway. So obstruct the airway means a patient unable to breathe it properly. So this is the meaning of obstructive airway. Because of the tonsil size will be enlarged, it leads to patients having the obstructions of the breathing. And next is the diagnostic evaluation for the tonsillitis, both acute and chronic tonsillitis. So first we'll do the history collection for the patient. So you should be collect the past medical history of patients exposure of or patients having any ear infection, especially in the otitis media, or patients having any or taking any treatment of or not taking proper treatment of acute tonsillitis, and patients having any sinusitis problem, and also patients having any upper respiratory tract infections. So these are all the history you should be collected, and also and also you should be asked the patients you are having any fever or throat pain or difficulty in swallowing or breathing difficulty. These are all of the symptoms the patients having or not. And next is the physical examination. In physical examination, you should be doing the inspection and palpation method for the throat. So already was said, so enlargement of the tonsil, enlargement of the each tonsil, it leads to obstructions of the airway. So and also enlargement of the lymph nodes. So once inspection method with use of or a torchlight, or ask the patient to open the mouth, and you should be check the enlargement of the tonsil presence over the patients or not. And also you see the tonsil patients having any yellow color spots over the tonsil or not, or any cheese like appearance of the tonsil or not, and any unnecessary exudate formations over the tonsil or not. So these are all things you should be find out in the inspection method. Next is the in palpation method. You should be palpate the each side of the jugular nodules. If any enlargements presence over the jugular nodule, enlargement presence over the jugular nodules or not. Okay, so this is the physical examination, and these are all the abnormalities you should be find out in the physical and ESD collection. And next we'll move on to investigation. So next we'll the first is the throat swab. So throat swab, it is help to identify the growth of bacteria stages in the oral cavity. And next is the monosparts test. This is the blood test. It dedicates the certain antibodies which can help to confirm the person's symptoms due to the mononucleases. And next is the Epstein-Barr virus antibodies. This is also one of the tests. It is help to patients having the tonsillitis or not. It is a and next is the blood test. If in this blood test CBC count will be do it. So if a patient having the tonsillitis means the CBC count will be complete blood count, the complete blood count. So in this WBC count will be increased. It indicates patients having the infected state. Next we'll move on to medical management. One of the main medication, it is the penicillin. So it is one of the antibiotic. It is help to prevent the growth status of the bacteria. And next is the ibuprofen. It is help to reduce the pain level. It is one of the analgesic medication. It is help to reduce the pain and also infection. Next we'll move on to surgical management. The surgical removal of tonsil. It means it is a tonsillectomy. So tonsillectomy means it is the removal of infected tonsil. See the picture. So it is a removal of infected tonsil. And next is the adenodectomy. Otherwise known as it is a tonsilloadenodectomy. It is both removal of adenoid and tonsil gland. So next one more surgical management, it is the electrosurgical tonsillectomy. So electrosurgical tonsillectomy means it is one of the newer technique of removal of infected tonsil. In this surgery method, the electrical magnetic radiation, it is generated to the heat within the tissues for cutting and coagulation. So it is a small amount of electromagnetic radiation. It is passed through the affected tonsil. It helps to cut the infected tonsil and also to prevent the blood, to prevent the unnecessary bleeding. So in this technique may reduce the risk for bleeding and produce less patient discomfort. See the picture. So this is the totally removal of tonsil with using of electrosurgical method. It is a newer technique. Next we'll move on to nursing management. If after the tonsillectomy, place a client in a lateral position until the client wake up and alert. The monitoring the vital signs and hemorrhages is the most serious complications, and start oral feeding if once recovery from the patients. If after the surgery, you should be see the patient's surgery sites. Patients having any bleeding over the surgery site or not. Okay, if a patient's having the continuous bleeding means immediately you should be informed the concerned physician. Next is the pain is the first 7 to 10 post-operative days. This can usually control with the liquid acetaminophen medicines within the codeine. Next is the avoid medications containing aspirin, ibuprofen or other inflammatory medication for 2 weeks. If after the surgery, patient should be avoided aspirin and ibuprofen medications. So if a patient having the fever following the surgery may occur and should be treated with acetaminophen. Well, children have fever, they should be play equally or remain in bed. Next is the ice collar application. It is help to prevent the hemorrhagic level from the patients. Next is the providing side-lying position for the patients. Next is the inspect the throats. Are any abnormal bleeding presence over the throat or not? Are any discharge or any color changes over the throat or not? Next, advise the patient to take fluids and citrusin juice and brown or red fluid should be avoided. Advise the patient to avoid citrusin juice and red fluids and brown should be avoided. Next is the complication of tonsillitis. So chronic tonsillitis, incomplete resolution of acute tonsillitis. Next is the peritonsillar abscess and parapharyngeal abscess, acute otitis media and recurrent attack. Next is the cervical abscess due to separation of jugulo digastric nodules and rheumatic fever, group A beta hemolytis streptococcus. Next is the substance bacterial endocarditis, patients with valvular disease and streptococcus variants and tonsillar cyst. So thank you. So let's conclude on my topic. So tonsillitis, it is one of the preventable disease if you take proper treatment for if you are having a yearly sign of throat infection, take proper treatment for sore throat. It is help to prevent the tonsillitis. Thank you.